Welcome back to this program, everyone. Today, we turn our attention to a compelling and rapidly evolving domain, the convergence of artificial intelligence and mental health. This is a field rich with the promise of transforming how we comprehend, diagnose, and address mental well being. Let us now explore the landscape of AI in mental health. Let's talk about the current mental health crisis and market size. It is imperative to first acknowledge the extensive scale of the mental health challenge on a global level. Mental health struggles represent a significant global concern, impacting millions across diverse populations. According to the World Health Organization, depression stands as the leading cause of disability worldwide, affecting over 264 million individuals. Anxiety disorders constitute another prevalent issue, affecting nearly 284 million people globally. These conditions profoundly diminish the quality of life for those affected and regrettably contribute to escalating suicide rates, taming over 700,000 lives annually. Furthermore, the demand for mental health resources is exceeding the available supply. Consider that the World Health Organization estimates a global shortfall of 1.18 million mental health workers by 2030. This disparity underscores a critical need for innovative solutions. While the precise market size is subject to change, it is evident that with such widespread impact and unmet needs, the mental health sector constitutes a substantial and expanding area. Let's look at common mental health problems today, examining the specifics more closely. The most common mental health problems today include depression, which, as previously noted, is the leading cause of disability. Alongside this, anxiety disorders affect a considerable number of individuals. Notably, the uncertainties stemming from the COVID 19 pandemic led to a reported increase in the prevalence and incidence of common mental health disorders, primarily linked to loneliness from previous conversation history. While some levels have normalized, the pandemic has highlighted the vulnerability of our collective mental well being. How technology can offer solutions this juncture marks the entry of technology, particularly AI, into the discourse. While it is crucial to recognize that AI cannot supplant human therapists, it possesses the capacity to significantly enhance mental health care. Envision AI as an instrument to support practitioners and provide supplementary care to individuals. For example, AI driven chatbots can conduct initial assessments, monitor patient progress, and even deliver cognitive behavioral therapy CBT techniques. These innovations are vital in helping to bridge the gap between the substantial demand for mental health services and the limited availability of professionals. Health tech leaders are positioned to develop AI driven solutions such as therapeutic applications, AI powered diagnostics, and virtual support systems to transform mental health treatment, rendering care more accessible and personalized. Affordable AI solutions can extend their reach to underserved populations and address the global shortage of mental health professionals, ensuring the greater number of individuals receive the necessary support. AI can also facilitate the development of customized treatment plans, provide round the clock support via chatbots and wearable devices, and enable real time monitoring and feedback. Even web based interventions are increasingly utilized, offering affordable access to psychological therapies, and telehealth services have demonstrated strong preference among patients and their families from previous conversation history. A key potential impact of AI lies in improving accessibility to mental health care. The stigma associated with seeking mental health support remains a significant barrier for many from previous conversation history. AI powered platforms offering anonymity and round the clock availability can provide a less intimidating entry point to care. Individuals hesitant to engage with human professionals due to fear of judgment or social repercussions may find solace in interacting with an AI chatbot. Furthermore, geographical barriers and the limited availability of mental health professionals in certain regions contribute to disparities in access. AI can extend the reach of mental health support to remote and underserved areas, ensuring that geographical location is no longer an impediment to receiving quality care. The World Health Organization indicates that integrating AI into mental health services could address the treatment gap in low income countries, where a significant majority of individuals with mental health disorders do not receive care. By offering scalable and cost effective solutions, AI has the potential to democratize mental health support, reaching millions who currently lack access. What are the key challenges in diagnosis? However, the progression towards widespread AI integration in mental health is not without its complexities, particularly in the realm of diagnosis. A fundamental challenge resides in the inherently subjective nature of mental disorders, characterized by intricate symptoms and considerable individual variations from previous conversation history. Unlike numerous physical ailments with clear biological markers, conditions such as depression lack clinically useful diagnostic biomarkers for definitive confirmation from previous conversation history. Current diagnostic criteria, often reliant on subjective experiences or quantitative descriptions, present difficulties for AI to objectively quantify and standardize from previous conversation history. There also exists an uncertainty in the correlation between mental disorders and symptom presentation from previous conversation history, and the within group variations in mental disorders can be substantial, posing significant challenges for recognition by AI systems. Ultimately, current AI remains limited in its capacity to effectively recognize mental disorders and cannot replace clinical diagnoses in the near future. Key challenges for practitioners today, mental health practitioners themselves encounter a distinct set of challenges. The limited availability of professionals to meet the increasing demand constitutes a significant obstacle. They are continuously navigating demand management strategies due to the heightened vulnerability to mental ill health. Furthermore, there is a lagging infrastructure and skill base that has constrained the widespread adoption of digital solutions in mental health care from previous conversation history. To effectively integrate AI, therapists will require training to utilize AI tools, to interpret AI generated insights, and to incorporate them into treatment plans. Concerns regarding the black box problem of AI, where complex algorithms lack explicability and transparency, can also impede practitioners' trust and effective utilization of these tools. How AI can help overcome these challenges. Despite these complexities, AI offers promising avenues to support both diagnosis and practitioners. As previously mentioned, AI can serve as a support system for therapists, managing initial tasks and monitoring patient progress. By expanding access to care, AI can alleviate some of the burden on practitioners. The development of customized treatment plans based on individual data holds the potential for more efficient and effective therapy. Predictive systems powered by AI could potentially assist in early intervention for individuals at high risk. Moreover, the incorporation of explainable artificial intelligence XE is paramount. XAI aims to enhance the transparency of AI decision making, enabling practitioners to understand the reasoning behind AI conclusions, thereby fostering trust and facilitating more confident application of AI insights. Real time screening and tracking through AI powered platforms can also aid practitioners in more effectively identifying and monitoring patients. Upcoming mental health issues for the next generation. Looking ahead, the next generation may confront unique mental health challenges. The long term repercussions of the COVID 19 pandemic on population mental health are still unfolding from previous conversation history. Furthermore, projections suggest a potential increase in common mental health disorders due to factors such as unemployment and related financial stressors from previous conversation history. The constant connectivity and pressures of the digital age also present novel avenues for mental health concerns that are only beginning to be fully understood. Impact of AI layoffs and uncertainty. This is a salient point for consideration. The recent layoffs and uncertainty within the AI sector. While my current sources do not offer specific insights into the direct impact of these events on the mental health AI space, it is plausible to surmise that significant economic shifts and uncertainty in the broader technology industry could influence investment in and the progression of AI driven mental health solutions. This remains an area requiring ongoing observation and analysis. Existing startups in the AI mental health space, notwithstanding the challenges, the AI mental health domain is marked by significant innovation. Notable existing startups include Wobot and Visa, which offer AI driven psychotherapeutic chatbots. These platforms exemplify the potential of conversational AI to provide accessible mental health support. Visa, for instance, has demonstrated that a significant percentage of its users find it helpful and has facilitated millions of CBT sessions via AI. Startup ideas are on the same building upon this momentum. Numerous compelling startup ideas exist within the space. We could witness the development of more sophisticated therapeutic applications leveraging AI for highly personalized interventions. The advancement of more precise and dependable AI powered diagnostics, potentially incorporating vocal biomarkers, holds substantial promise. Virtual support systems offering more comprehensive and human like interactions could also emerge. Startups concentrating on explainable AI, XI for mental health, ensuring transparency and fostering trust in AI generated insights would be invaluable. Finally, platforms integrating real time screening, tracking, and treatment utilizing AI with a focus on cost effectiveness for vulnerable populations represent a significant opportunity. Computing remarks for the audience. In conclusion, the application of AI in mental health presents a multifaceted landscape characterized by both considerable opportunities and notable challenges. While AI cannot replace the crucial human element in therapy, it possesses the potential to broaden access, personalize care, and support practitioners in meaningful ways. It is imperative, however, to navigate the complexities in diagnosis, address ethical considerations such as data privacy and security, and ensure thoughtful implementation with diligent oversight. As AI continues its evolution, its role in mental health care is poised for significant expansion. By fostering collaboration among technology developers, mental health professionals, and policymakers, we can harness the power of AI to cultivate a future where mental health support is more effective, accessible, and equitable for all. Thank you for joining us for this discussion, and we invite you to tune in next time as we delve into another intriguing facet of artificial intelligence. Hope you like it.